My name is Cheri Kiefer. I'm the Oral Health Program Director for the North Dakota Department of Health. My disclosure is I am not a dentist. My background is I am a nurse and a dietitian by trade. My only association with dentistry before my position here would be my own personal experience going to the dentist. In high school, I was one of those that had to have braces. I was born without my lateral adult incisors. So if you're wondering where those are located, they would be right next to your two front teeth on both sides of your mouth, and had to go through the experience of having braces, having to wear a retainer, having to have a retainer with false teeth, and just kind of going through the experiences of teenage life with braces is sometimes not very pleasant, I'll say that. But now my son is going through the same process, as he was not born either with his lateral incisors, so he's experiencing going through braces right now. So with that being said, I am very honored to be here with you today to talk about oral health in North Dakota and why oral health is important and how it may impact chronic disease conditions. Next slide, please. For those of you who are not familiar with the North Dakota Department of Health, the Oral Health Program is located in the Healthy and Safe Communities section within the Division of Health Promotion, which is outlined in red here. Next slide, please. The Division of Health Promotion includes our diabetes, heart disease, and stroke prevention and control programs, the Oral Health Program, and the Preventive Health and Health Services Block Grant. And this is a picture of me pre-COVID in the office at the North Dakota Department of Health, just having fun one day at work. So next slide, please. A little bit about who we are when it comes to the Oral Health Program, because they need to be mentioned as well. Our team is so amazing, and without them, we would not be where we are today. So our Health Promotion Division Director is Jana Pasteur, myself, the Oral Health Program Director, our Prevention Coordinator, Tony Ruby, who is also a dental assistant, our Clinical Community Coordinator, Melissa Kientz, who is a nurse by trade, and then we have two registered dental hygienists on our team, Vanessa Bob, Ada Nolan, and then we do have Dr. Mike Goebel, who is the dentist who oversees the standing orders for our dental hygienists. Next slide, please. And this is just a fun picture of our oral health team pre-COVID. From left to right, myself, Melissa Kientz, Carlene Shear, who is one of the many administrative assistants with the North Dakota Department of Health, Jana Pasteur, Terry Arso, who is our administrative assistant specific to the Oral Health Program, and then Tony Ruby, who is our prevention coordinator. Next slide, please. And then here we have Vanessa Bopp, who I mentioned before is one of our registered dental hygienists, and she is providing prevention education to the children at one of our Head Start locations in North Dakota, talking to them about proper brushing of teeth and how to keep their mouth healthy as they become adults. So next slide, please. The Oral Health Program has been able to contract with two external evaluation teams, one from the Center for Rural Health at the University of North Dakota, located in Grand Forks, North Dakota. And then we have another evaluation team from the Wyoming Survey and Analysis Center, also known as WYSAC, which is located in Laramie, Wyoming. And we are so blessed to have these two evaluation team members working with us, because they really serve as the eyes and ears for planning the next steps of the program as we move forward in our grant work. Next slide, please. My hope for today is that at the end of the session, attendees will be able to describe why oral health is critical, as well as areas of need in North Dakota, identify oral health interventions employed by the North Dakota Oral Health Program, and how might these be implemented in your community, identify ways to address oral health in other community health programs that you might be working on as well. Next slide, please. So the big question people may be wondering is, why is oral health really important? Next slide, please. Oral health is so important as it plays a crucial role in a person's overall health, development, and well-being. Cavities are the most common chronic conditions among children in the United States. About 1 in 5 children aged 5 to 11 years old have at least one untreated decayed tooth. Untreated cavities can cause pain and infections that may lead to problems with eating, speaking, playing, and learning. Periodontal disease, also known as gum disease, has been associated with several health conditions such as heart disease and diabetes. Periodontal disease, like I said, is known as gum disease, is an infection in the gums that damages the soft tissue and destroys the bone that supports the teeth. Symptoms of periodontal disease may be bad breath, red and swollen gums, tender or bleeding gums, pain when chewing, loose and sensitive teeth, and receding gums. Periodontal disease is associated with heart disease and diabetes, as the bacteria causing the inflammatory reaction in the mouth may enter into the bloodstream. Despite improvements in oral health, disparities exist for many racial and ethnic groups by socioeconomic status, gender, age, and geographic location. Some factors that can contribute to these differences are lifestyle behaviors, which may include tobacco use, alcohol use, and poor food intake choices. Even as these factors can affect general health, they can also affect oral health. The good news is cavities, periodontal disease, and other chronic diseases can be prevented. The best way to prevent cavities and periodontal disease is to follow a program of good oral hygiene, one that begins early in life and you follow consistently throughout life. This means brushing your teeth for 2 minutes at least twice daily, perhaps in the morning and before going to bed with fluoridated toothpaste, and flossing your teeth 2 times a day. And also setting up regular dental visits for routine checkups and professional cleanings should be included in your routine of good oral health hygiene. Individuals can look at ways to improve lifestyle behaviors, such as quitting tobacco use, avoiding alcohol, and choosing nutrient-rich foods to eat throughout the day. Next slide, please. Oral health is essential to general health and overall well-being of a person. Poor dental health may contribute to other health problems. As you can see from this picture, oral health means much more than just healthy teeth. Oral health includes the gums, saliva, the hard and soft palate of the mouth, your lips, tongue, throat, and supportive connective tissues and bone. But we can't forget that the mouth is also connected to your vital organs, circulatory, and nervous systems. Heart disease may be caused by the spread of bacteria and other germs from your mouth to your heart through the bloodstream, like I mentioned before. When bacteria reach the heart, they can attach themselves to any damaged area and cause inflammation. Individuals with diabetes have a higher chance of having periodontal disease or gum disease. Individuals with diabetes may have a decreased healing time. They may also show signs of having dry mouth and fungal infections within the mouth. The dry mouth can cause sores, infections, and tooth decay. Individuals who smoke may make these problems even worse. People who smoke are at a higher risk of developing oral and lung cancer and gum problems, which can lead to tooth loss. Next slide, please. So what are we seeing in North Dakota when it comes to oral health disparities? During the 2018-2019 school year, the oral health program completed dental screenings in 43 of our public and Bureau of Indian educational schools in North Dakota to assess kindergartners' oral health. Compared to non-Hispanic white kindergartners, those that were of American Indian or Alaska Native descent had a significantly higher prevalence of decay experience, untreated decay, rapid decay, need of early or urgent care, or just need of urgent care. Next slide, please. Here you can see that during the 2018-2019 school year, a majority of all kindergartners had decay experience. However, 93% of American Indians or Alaskan Native kindergartners presented with decay. Nearly half of all kindergartners screened had untreated decay, whereas American Indian or Alaskan Natives had significantly higher incidences of untreated decay at 65%. 23% of all kindergartners had rampant decay, and 54% of American Indian or Alaskan Natives had a significant higher prevalence of rampant tooth decay. Overall, the need for early and urgent dental care is needed for all kindergartners. We are seeing that American Indians or Alaskan Natives are significantly more likely to need early and or urgent dental care. Next slide, please. During a 2016 nursing home facility survey, we see here that residents with Medicaid had a higher prevalence of edentulosum, which means no teeth, substantial tooth loss, untreated decay, gingivitis, and the need for periodontal care than those covered by other payer types. Next slide, please. Here we can see that there is a decline in the number of people going to the dentist in North Dakota and overall in the United States. This decline continues among various income levels and regardless of dental coverage or not. Next slide, please. So how is the oral health program responding to the need of oral health in North Dakota? It is through 2 federal grants, one from the Centers for Disease Control and Prevention, and the other from the Health Resources and Service Administration grant, that the North Dakota Oral Health Program is able to implement oral health activities across North Dakota with various partners to improve the oral health of all populations or citizens within North Dakota. The CDC State's Action to Improve Oral Health Outcomes grant was awarded in September 2018 and is a 5-year grant. Under this grant, the North Dakota Oral Health Program works to decrease dental caries, oral health disparities, and other chronic diseases comorbid with oral health. The HRSA grant, we call for short, is grant to states to support oral health workforce activities, was awarded also in September 2018 and is a 4-year grant. The purpose of this grant is to help states develop and implement innovative programs to address the dental workforce needs of designated dental health professional shortage areas in a manner that is appropriate to each state's needs. Next slide, please. Through the CDC grant, we are focusing on 4 areas, as displayed here. The school-based sealant program, also known as CLND for short in our state. Here we are partnering with private dental offices, federally qualified health centers, Indian Health Services, and the various schools across North Dakota to provide preventive oral health care to the students. We are also working on community water fluoridation with our partners from the American Fluoridation Society. We continue to work on data surveillance. This is an ongoing process with all of our projects that we are working on. And then we are also working on a medical dental integration piece, monitoring or screening for blood pressure within the dental offices throughout North Dakota. Next slide, please. With our HRSA grant, we are also focusing on the school-based sealant program, but this focuses more on the case management side of the program for CLND. We also have a program where we have dental students rotating through our federally qualified health centers to help with their fourth-year dental student rotations. And then we have a medical dental integration piece in there as well, where we are working on an emergency room diversion project, and then a public health hygienist is actually providing services within a medical office located at the University of North Dakota Center for Family Medicine here in North Dakota. Next slide, please. The CLND program, which is our school-based sealant program, started in North Dakota in 2012. CLND, we have a public health hygienist who actually goes into the schools to provide preventive oral health care to the students. Preventive services include providing the children with a dental screening, oral health education, fluoride varnish application, and dental sealants. CLND prioritizes providing preventive oral health care to low-income and underserved students throughout the state of North Dakota. We target schools with 45% or greater of their students enrolled in the free and reduced fee school lunch program. Although schools with larger proportion of youth who are low income are prioritized, additional schools do also participate in CLND. We also partner with other dental providers across the state to help with the school-based sealant program. They could be a private dental office, they could be a federally qualified health center that is helping assist with this as well, any dental providers from the Indian Health Services, and they also go to the qualifying and non-qualifying schools across the state. Next slide, please. In the 2019-2020 school year, CLND reached 80 participating schools. We had 3,578 dental screenings, 3,617 students received the fluoride varnish, and then there were 6,225 teeth protected by a dental sealant. And that dental sealant is really just a thin coat that is painted on. It protects those back molars or teeth from food and germs and prevents cavities. Once applied, sealants protect against 80% of cavities for 2 years and continue to protect against 50% of cavities for up to 4 years. Next slide, please. During the CLND program, our health education is also provided. Here, the hygienist talks about the importance of brushing their teeth with the kids with fluoridated toothpaste 2 times a day and flossing daily with the children. They may also educate the students on why it's important not to be sharing toothbrushes, as this may pass on bacteria from one person to another. The dental hygienist also provides education depending on what the children are asking, but some things that they could be providing education on are, eating more fruits and vegetables, decreasing their intake of those sugary foods and drinks, encouraging more drinking of water, especially from your tap water, and making sure to get in enough physical activity throughout the day. Next slide, please. This ULND case management piece is really where we make sure any child identified with needing further dental care is referred on to their dental home and the dental care is completed. This also is a great way to build relationships with the dental offices in the communities that the schools are located in and learn ways that we can help with reducing any barriers between the dental offices and the patients if there should be any. So it's a great chance to really follow up and make sure that those kids are receiving the care that they need. Next slide, please. With our community water fluoridation project, we are partnering with the American Fluoridation Society. Here in this picture is Johnny Johnson, who is a retired pediatric dentist and president of the American Fluoridation Society, and one that I call my friend. Next slide, please. Fluoride is a mineral that exists naturally in water, such as our rivers, lakes, groundwater, and the ocean. It's nature's way to prevent tooth decay. Fluoridation occurs when a local water system adjusts the natural fluoride to reach the optimal level of 0.7 parts per million. Fluoride has been added to public water systems throughout the United States for the past 75 years to help bring up the levels of fluoride in the water to amounts necessary to help prevent cavities, also known as tooth decay. Drinking fluoridated water keeps teeth strong and reduces cavities. The addition of fluoride into the water is just like when we have milk where calcium is added into the milk. It's as safe as that. Next slide, please. Fluoride protects and remineralizes the structure of the teeth, making it more resistant to decay. Fluoride may also interfere with the ability of decay causing bacteria to adhere to those teeth. Next slide, please. And then fluoride comes in various shapes and forms. It's in our toothpaste, it's in the mouth rinses, it's in the varnish applied at the school-based sealant programs, and then it's added during the community water fluoridation process as well. Next slide, please. The good news is 96% of North Dakotans who are served by a public water system receive tap water that is fluoridated. So they really reap those benefits of having fluoridated water to help with preventing tooth decay. Next slide, please. We know that some North Dakota reservations are adding fluoride to their drinking water as well, but we're unsure of this exact number in the communities that we are working with. The oral health program is currently in conversations with our partners, the Quality Health Associates, which is a nonprofit entity who works mainly with the medical health systems within our state and then with our tribal nations. We are currently working on building partnerships with Standing Rock Sioux Tribe and Turtle Mountain Banded Chippewa to really better understand the needs of those community members when it comes to oral health. I certainly don't want to be coming into those communities as a white woman stating, here, this is what you have to do. I really want to understand what their needs are and do what they would prefer to have us working on when it comes to oral health. So we also continue to work with the American Fluoridation Society as well on this project because it's really a passion of the American Fluoridation Society and working at a national level to really help those tribal communities receive fluoridated water through many discussions with different partners. We have learned that there are some communities there's households that don't have running water that I didn't really even realize. And, you know, every day I turn on my tap water and I take it for granted that, you know, I'm blessed to have fluoridated water, but there are some community members within North Dakota that I didn't realize that don't have that blessing in their household. So we really want to provide that access to those community members that don't have that. Next slide, please. Through our HRSA funding, we support Spectra Health, which is a federally qualified health center in Grand Forks, North Dakota, to have fourth-year dental students who are actual native North Dakota residents complete their dental rotations at their dental office. Spectra also does support Iowa students in their fourth-year dental rotation to come to their dental office to have that experience as well. Our grant funding does not support the Iowa students at this time. Here, students are performing mostly restorative services, but they're really having a very beneficial rotation when they go through the federally qualified health center. As shown on this slide, you can see that the program should be recognized. I don't think anything we have here at our school can compare to this experience. It is the best rotation and the people are wonderful, and I could not recommend them more highly to any student. So those comments really speak a lot about the experience that they're having. It's unfortunate that many of the dental students don't go back to those federally qualified health centers to actually work in because of the pay that they would not receive. Going to dental school is not cheap. So they, you know, on the top of their minds is always, you know, how am I going to pay that loan back? But Spectra Health was able to hire one student from their rotation who is working in their dental office at this time. So that was very beneficial. Next slide, please. Here are just a few of the data points we've collected over the years throughout both of our grants for CDC and HRSA. We are continuously, you know, collecting the data on the activities we're working on. Data is always de-identified, meaning that we do not have anybody's individual name out there for the public to see or know about. We continue to update our oral health webpage. You can find various documents produced by our great evaluation teams at www.oral.health.nd.gov. If you want some late night reading some evening when you're not so busy. So it's really the website too we are working on. So it's user friendly and data is available for the public to see and use. Next slide, please. With our data surveillance, we were able to survey the dentists throughout North Dakota on their screening and opioid prescription practices. We found that many dentists in North Dakota were not overprescribing. When they did prescribe opioids, it was a prescription for 2 days for the patient. And you can see in this slide the various reasons for why they did prescribe the opioids. The oral health program also explored data to understand where residents go when they are experiencing tooth pain. Data was collected between 2015 and 2018 and was pulled from the North Dakota Essence database, which is an electronic surveillance system for the early notification of community-based epidemics. That's a mouthful there for you. North Dakota Essence is really an electronic surveillance system that consists of emergency department, urgent care, and walk-in clinic visit information. There are significant limitations to the data. For example, the numbers do not reflect true visits, but are based on queried keywords from only those hospitals that participate in data reporting. Regardless, it is the only means of beginning to understand current practice. And what we found was that the rate of tooth pain visits in North Dakota have increased within some of the ER departments at the hospitals in North Dakota from 2015 to 2018. Next slide. And this is just showing that increase from the North Dakota Essence data. Next slide, please. Another project that we are working on is our ER diversion project in partnership with Quality Health Associates of North Dakota. The work will include completing an environmental scan in 2 North Dakota communities and looking at implementing an emergency department diversion program in partnership with the dental providers throughout the state, and based off of the data from the needs assessments collected from the emergency room staff interviews, the dental off staff interviews, and patient interviews. So time will tell with this project on which direction it will really go, because we really need to dig down deeper into the data to see what direction that we should take this project in. Next slide, please. Part of our medical dental integration project that I mentioned earlier on in this presentation is our blood pressure pilot project. In North Dakota, 1 in 3 adults are diagnosed with hypertension or high blood pressure, as individuals would know it. High blood pressure costs the nation about $49 billion annually in healthcare services, medications, and missed days of work. Also, hypertension is a silent killer. There's no way to identify if you have hypertension as you're walking around. You really have to be screened for it and monitor your blood pressure to know if you really have high blood pressure or not. The oral health program has implemented a pilot project addressing high blood pressure in dental practices. The oral health program has currently partnered with 14 dental offices across the state up to this point, with the federally qualified health centers, with Indian Health Services, with nonprofit dental offices, and with private dental offices. And we know that when the dental professionals go to school, this is part of their curriculum, is to learn, to take a blood pressure accurately. So we're not stating that they don't know how to do this. We're just providing the education to them as a refresher, just like a nurse would need refreshing on, taking a blood pressure. The dental offices may need a refresher course as well. So we have Quality Health Associates providing training to those dental offices, either prior to their contract with us or during the first part of their contract program period with us, to make sure that we get in on the front end of everything with making sure that they know the proper procedures, again, for taking blood pressures on those individuals that are coming into their dental office. As you can see here, that in year 1, we conducted 13,147 blood pressure screenings in 3 of the dental offices that were actually contracted with us in year 1. And then it grew in year 2 to 9 dental offices working with us, and we were able to increase the number of blood pressure screenings that occurred in year 2. So I'm sure as we move along in this project, we'll be screening more individuals that are visiting the dental office as well. And then also, if they are identified as having high blood pressure in the dental office, those patients are then referred on to their medical provider to have their blood pressure monitored or screened again, just to make sure that those blood pressures are in control. If individuals are not identifying that they have a primary care provider, then those dental offices, perhaps will locate somebody within a local public health unit or within a local pharmacy that would be more than happy to, take their blood pressure again and get them in on the right direction so that their blood pressure is monitored. So the ultimate goal at the end of the day for this project is to really have a true bi-directional referral process in place with the dental office and the medical provider. So also learning what the medical providers are doing when it comes to oral health screening, and then making sure that they can refer any patients to a dental home or a dental provider if they should see that any of their patients have any oral health needs that need to be taken care of in a dental office. Next slide, please. We also have our public health hygienist, Vanessa Bopp, working at the University of North Dakota Center for Family Medicine, located in Bismarck, North Dakota here. The University of North Dakota Center for Family Medicine is a teaching clinic which helps educate doctors specializing in family medicine. Vanessa was actually at that clinic pre-COVID. She was working Monday through Friday, but now her days going to that office has decreased to twice a week, just because of staffing within the facility, and then not many individuals are actually going back in to get the preventive care that they should during this time. Vanessa, she provides direct preventive services to the patients when they come in, and when I mean patients, she has seen, infants to our older generation, and she may be educating both the mother and the father at the same time while the child is in the room, or it just might be education to one individual depending on the circumstances. So she provides dental preventive services to patients on, doing a dental screening. She applies fluoride varnish application for free. She refers individuals to a dental home or a dentist if they need further treatment, and then she does provide dental sealants as well for free to anybody that should need them or is agreeing to have those placed. Another unique thing about having a dental hygienist within a medical facility is that she's providing dental education to the medical staff, the medical residents, and the clinic staff working at the clinic. The education provided is based off of the Smiles for Life curriculum. The Smiles for Life curriculum, consists of 60-minute modules covering core areas of oral health relevant to the health professionals. So she's a valuable asset to their team, and we've been getting great responses back on the education that she's providing to those new residents and to the current staff, because most times in medical school, they're not getting the dental education that you would if you're actually going into dental school. Next slide, please. And then this is just a slide showing the work that Vanessa is doing with the dental integration project down at the University of North Dakota's Center for Family Medicine. You can see that she's handing out brochures, she's providing dental education, dental supplies are provided. And when I talk about dental supplies, that means she's providing a toothbrush, toothpaste, and floss to each patient that is willing to take that with them. She's applying fluoride varnish and then referring anybody that needs more dental care to an actual dentist because we don't have a dentist actually working in a medical facility within North Dakota, but we would certainly invite that opportunity to happen, and it would be a great learning experience for everybody. So, and then I failed to mention that also within Vanessa's work, she does have an asthma clinic that she goes to during her time down at the Center for Family Medicine. And you can see the difference in the amount of supplies and education given buried here too. So next slide, please. Overall, the goal is to empower people, improve lives, and inspire success, with the oral health program. And we really hope to do that each and every day with each encounter, each partnership that we make, and every opportunity that we have. We are planning to have the first ever oral health state engagement meeting virtually in May, May 6th and 7th. We were supposed to have that meeting last year, but then our friend COVID put a damper on that. But we'll be looking at access to care, increasing utilization of dental services, increasing Medicaid reimbursement, and partnerships throughout North Dakota to really help move the needle forward when it comes to oral health in North Dakota. So if anybody is interested in learning more about that opportunity, I welcome you to reach out to me to learn more about that, because it's not only a meeting for dental professionals, it's a meeting for anybody that's passionate about oral health and making a change. It is for school systems, Head Start, Indian Health Services, the medical community, community members at large to really participate, have a voice in the direction that oral health should go in North Dakota in the coming years. And next slide, please. With that, I really want to thank you all for letting me present today. I'm honored to have the privilege to have spoken to you all. If you have any questions, we can cover those now, or if you don't feel comfortable asking your questions right now, please don't hesitate to reach out to me by email or calling. I know sometimes it's hard to ask questions after on these webinars too. So with that, I open it up to any questions anybody has, and thank you so much. And I hope everybody stays healthy, safe, and you have a wonderful holiday season.
Thank you so much, Cheri. We really appreciate you coming on and sharing all the great work that you guys are doing in North Dakota in oral health. So thank you. I'm gonna leave your contact information up just for a little bit longer, but I did see a few questions in the chat.
Okay.
The first one was just if you could say the website address again that you had mentioned earlier.
Yeah, it is www.oral.health.nd.gov, or if you don't remember that, just do a Google search on the North Dakota Oral Health Program, and that will really get you there too. So.
Great.
And I see you put that up too. Thank you, Shannon.
Yes, I wrote that down quickly as you were saying it. So it's in the chat for anyone that needs it now. The other question we had was, how do you track the preventative services that the public health hygienists perform? Via a handwritten form or using an electronic data entry program?
That's a great question. We actually started out using paper forms for the school-based sealant program that the dental hygienist actually would fill out, and it's specific to what they're screening on and looking at each tooth like they would in a dental office. And I'm not a dentist or a dental professional, so the terminology is escaping me at this time, but then we moved to a system called Maven, where we are doing that all electronically. So hoping that that would speed up the process of entering data in there as we move forward. But we're working on that piece a little bit more. So I hope I answered your question.
Great, thank you.
Yep.
Does anyone else have any questions they would like to ask? You can type in the chat or the Q&A box. Just a reminder, this webinar was recorded, so there'll be a follow-up email with the link to the recording. We will put it on our YouTube page. And when you exit out of this screen, a feedback evaluation survey will pop up. We really appreciate everyone filling that out and giving us feedback and some ideas for future topics for these webinars in the future. One last question. So he says, what is the name of the data entry system again? Is it Maven?
Yes, it's Maven, and it was actually produced by our chronic disease division for the state of North Dakota. So they actually built onto their platform specifically for the data entry that we do for our school-based CILM programs. And the back end of how it all works, I'm not quite sure, Charles, so I can't really speak to it all. But it's, yeah, Maven is correct. So.
Okay.
All right.
Thank you, Cheri, and thank you everyone for joining us today. Our next webinar will be January, gosh, I can't remember the date, 13th, I think. And our topic will be on engaging the youth during COVID-19 in your programs and keeping them active during this time. So keep a lookout for that registration link and invite. And again, thank you, Cheri, and thank you everyone for joining today. I hope you have a great day.
Thank you, everybody. Bye now.